Let's learn about the ulnar nerve, its course, branches, and function in hand movement and sensation. Ulnar nerve. The ulnar nerve arises in the axilla, from the medial cord of the brachial plexus, C8 and T1. In the axilla, the nerve lies medial to the third part of axillary artery. It enters the arm as part of main neurovascular bundle and runs distally along the medial side of the brachial artery up to the mid-arm, approximately at the level of the insertion of coracobrachialis, where it to enter the posterior compartment of the arm and runs downwards to the back of the medial epicondyle of humerus. On the back of medial epicondyle, it is lodged in a groove where it can be easily palpated. The groove is converted into a tunnel called cubital tunnel by a fibrous band extending between medial epicondyle and olecranon process. The ulnar nerve crosses the ulnar collateral ligament in the floor of the tunnel. The ulnar nerve does not give any branch in the axilla and in the arm. The nerve enters the forearm by passing between the two heads of flexor carpi ulnaris. In the upper third of forearm, it runs almost vertically downwards, under flexor carpi ulnaris. In the lower 2/3 of the forearm, it becomes superficial and lies lateral to the flexor carpi ulnaris. In the forearm, it gives off the following branches. In the proximal forearm, it gives muscular branches to flexor carpi ulnaris and medial half of flexor digitorum profundus. In the mid-forearm, it gives off palmar cutaneous branch, which enters the palm, superficial to flexor retinaculum 2, provides sensory innervation to the skin, over the hypothenar eminence. In the distal forearm, about 5 centimeters proximal to the wrist, it gives off dorsal cutaneous branch, which provides sensory innervation to the skin, over the medial third of the dorsum of the hand and medial 1.5 finger. The ulnar nerve enters the palm by passing superficial to the flexor retinaculum, lying just lateral to the pisiform. Here, the ulnar nerve is covered by a fascial band called volar carpal ligament. The space under the fascial band is termed ulnar tunnel. Just distal to pisiform, the ulnar nerve divides into its terminal, superficial, and deep branches. The superficial terminal branch supplies palmaris brevis, provides sensory innervation to the skin on the palmar surface of medial 1.5 fingers. The deep terminal branch enters Guyon's tunnel under cover of pisohamate ligament and turns laterally within the substance of adductor pollicis, which it supplies. The deep branch of the ulnar nerve is purely motor and supplies all the intrinsic muscles of the hand, except the muscles of the thenar eminence and the first 2 lumbricals. The ulnar nerve is often referred to as nerve of fine movements or musician's nerve because it innervates most of the intrinsic muscles of the hand that are involved in the fine, intricate hand movements as required by the musicians while playing musical instruments. That was the ulnar nerve in brief. Like, share, and subscribe for more anatomy videos.